Dr. Sri Rannjitha, evaluating hemophilia care and hemoglobinopathies in the state of Andhra Pradesh. Dr. Sri Rannjitha is the nodal officer for blood disorders at office of DME, and she also worked as an assistant professor at transfusion medicine at SMC Vijayawada. So I will request ma'am to guide us on the same. Over to you, ma'am.
Good morning everyone. I'll be dealing my session in a brief view because most of the topics are covered by my previous speakers and important topics will be covered by the speakers talking later. So just the statistics part I'm going to cover now, which is of less important, but to know the burden of the disease we have to deal with this topic. I'll briefly introduce the topic of hemophilia. Next, the current status of hemophilia, burden, disease burden, existing initiatives taken by the government of India, and the challenges and opportunities, the way ahead. Coming to hemophilia, as I'm already madam did so much in detail, so I'm not going in detail. Just to be aware of that situation, only 1 in 5,000 males, as a professor said, this is a very rare disorder, but it is very much underdiagnosed. So many patients, they don't know as such that they should approach someone to deal with the disease, and clinicians in peripheral areas mainly. If some teaching hospital is there, we have more facilities to work up the diseases, but in peripherals, it will be little bit difficult to deal with these diseases. So, in 1 in 5,000 males are born with this hemophilia disease, and also some spontaneous mutations can occur that can lead to this disease. As this is the genetic pedigree chart, like if a male person is affected with hemophilia and he marries a normal woman, all the daughters can be the carriers who potentially marry another normal individual, and their sons can get the hemophilia disease. There is a survey going on globally. The survey had on 2022 by World Federation of Hemophilia. In the world, there are approximately 450,000 individuals suffering with hemophilia, and among them 271,000 are hemophilia A and B, and some are unknown. And other diseases, other bleeding disorders that are very rarely diagnosed and we miss the patients is von Willebrand disease, and some platelet disorders also like Lanzmann thrombocythemia and all. We are going to see this in this session so that they can be diagnosed and treated in time. So this is regarding the statistics in India. Among the 1.4 billion individuals, 25,715 individuals are suffering with hemophilia A and B. That is 17.4% of the identified patients. When we compare world with India, approximately 10% of the world hemophilia patients are in India. So we have to be more careful, and we should find more patients who are suffering and treat them in time. So this is the disease burden in Andhra Pradesh we already saw. Considering the 26 districts in Andhra Pradesh, there are some hub centers like this Hemophilia Society people, they are dealing with different districts. Coming to Visakhapatnam, they are dealing with the 4 districts: Srikakulam, Vizianagaram, Anakapalli and Visakhapatnam. Anantapur, Kurnool, and they are dealing with their respective districts. Kadapa, Chittoor and Kadapa are covered by Kadapa Society. And Vijayawada, which is a major society, they are dealing with so many districts from entire coastal belt, most of the coastal belt. East Godavari to Nellore, they are registered under Hemophilia Society of Vijayawada. So coming to the statistics of Vijayawada Society, there are around 1,000 patients, live patients with hemophilia. And when we see this other districts, they are totally accounting for 1252. And majorly we are treating here around 1000 individuals in Vijayawada chapter only. So in under hemophilia NHM, we are providing factors and any, like if factors are not available at one center, we are able to provide by procuring from nearby centers also. So please coordinate with the nearby Hemophilia Society people and NHM so that the factors will be delivered to the patient in time. Coming to the sickle cell disease. Sickle cell disease, mostly in tribal areas only the prevalence of sickle cell we are seeing more. So in different states like Rajasthan, Madhya Pradesh, Gujarat, Maharashtra, Tamil Nadu and Maharashtra, Orissa, mostly these states have more prevalence of sickle cell disease. Disease burden, as already told, 1687 patients are there in AP. So under National Sickle Cell Anemia Elimination Mission 2023, Government of India has taken so many initiatives like providing hydroxyurea to the patients. And for the information, as already Madam told, blood for any bleeding disorders or congenital bleeding, like congenital hemoglobinopathies, any blood center, not only government, they should not ask for any replacement or charge the patient. Some clinicians, please keep this in mind, because we are seeing so many individuals for sickle cell, aplastic anemia and thalassemia, like they are getting difficult for getting blood from blood centers. So you can demand the nearest blood center, any blood center, whether it is government, NGO or non-government. They are bound to supply blood products to these congenital hemoglobinopathies and like hemophilia factors. We have government supply for this hemoglobinopathy patients. So please be aware and help the patients. And coming to the sickle cell disease management, mainly mass screening under this National Sickle Cell Elimination Mission. Depending on the prevalence of the disease, they are going to test mass screening. If the prevalence is high, all the individuals, universal screening will be done. And for the disease states with low prevalence, target group, if some individual you are suspecting of sickle cell disease, if he or she is diagnosed with sickle cell, the entire family can be tested so that like our uncles or the patient's relatives can also be tested to diagnose the patients. And also under primary prevention of the disease, premarital counseling and genetic counseling is now being taken up. So if some individual is suffering with sickle cell, we can educate them that before marriage they can be, like with the husband, they can also be checked for sickle cell, so that two carriers did not marry and born a sickle cell disease baby can be born. This is the Government of India approach for the sickle cell disease to eliminate the disease. Coming to hemoglobinopathies, most common disease we are seeing more thalassemia babies, because if they are not diagnosed and given transfusions in time, sometimes we are losing babies also. So please, the disease burden, around 2,100 patients are suffering from thalassemia. As I already told, we are here at Vijayawada. I am not aware of other districts. In Vijayawada, thalassemia disease in babies is allotted to some blood centers, so that we can get the follow-up that if some baby is diagnosed with thalassemia, they will be allotted to the nearby blood center. So if they need blood, they can approach that blood center, and we are getting statistics every month that how many individuals of thalassemia are getting transfusions, so that we can evaluate the disease burden and also the services from the blood banks or blood centers. Coming to the challenges we are facing now, as I already told, sickle cell and all are more common in the tribal areas. So for that people, it will be very difficult to access the nearby health center. And lack of awareness among healthcare workers is also there. Like due to they don't know about the disease. Simple. Like we are discussing about the thalassemia, hemophilia, some very rare diseases like von Willebrand disease and hemophilia, like Punjab hemoglobin is there. So many diseases are there. They are underdiagnosed. Due to that unawareness, we are missing so many patients. And on-demand or episodic replacement therapy we are getting from NHM with the supply of the factors. Lack of emergency services 24/7. Here at district hospitals and CHCs we have 24-hour service and emergency service, but peripherally they are lacking it. So sometimes we are losing patients like that. Comprehensive care treatment. So as already Sonia madam covered, nursing care and physiotherapy is also more important in cases of hemophilia. Rehabilitation centers with capacity building. Entire hemophilia care can be set up at a single hospital so that the patients need not roam around different hospitals for different care. And unavailability of digital entries for monitoring. So this thalassemia and all, they are not like registered anywhere. Randomly we get patients, we are giving treatment, we are giving transfusions. If some digitalization is there, we can provide better service. Coming to way ahead, what we can do is regular replacement therapy for active lifestyle of the hemophilia patients, specialized treatment programs, main awareness programs are more important. Like this, last year we conducted one session, this year also we included district hospitals and all to create awareness. Collaboration with hemophilia centers to provide comprehensive care and treatment of individuals. So this concludes my session. Thank you for giving me the opportunity.